Alright, so this model will show the entire structure of the spinal cord. So gross anatomy of the spinal cord, by the way, it's not the microscopic anatomy of the spinal cord. So gross anatomy of spinal cord, again, we got spinal cord and this brainstem right up here, a section of the cerebrum. So it's showing you all the cranial nerves. So your job is to know where are they and where they are, and function and all that. So down below from the medulla oblongata is your spinal cord. It's starting from your foramen magnum of the occipital bones, if you want to remember that. So right here we have the cervical enlargement of the spinal cord. It's because we got nerve coming out from that section, control the upper extremity. And down here we have the lumbar enlargement. That's because we got motor neuron that come out from that section to control the lower extremity. There's no enlargement on the thoracic and the sacrum at all. Okay. Alright, so right here we call those the cornus medullaris. That's where the true spinal cord stop, and then they start branches up into different fibers. We call those are the cauda equina, which is the horsetail. And then when it goes straight down into the tip of the spinal cord is the filum terminal, and it's right within the coccyx. So the coccyx will straighten the spinal cord straight down. Okay, so come up here. One of the nerves that we pay attention is coming from the cervical plexus. It starts from C3 to C5, and it's right there and coming up right there. That's your phrenic nerve, and that controls the diaphragm contraction. Okay, and this guy you can see it sits right on the front of the scalene muscle, the anterior one, and it's right behind your sternocleidomastoid muscles, so to speak. You hate someone, you chop right there and you die. Okay, so that's cervical plexus from C1 to C5, and we talk about the brachial plexus more in this class, which is from C5 to T1. So C5 is right there, C6, C7, C8, and T1. Okay, so that makes up your brachial plexus. You can see this guy right here that coming out from the spinal nerve. Those are the ones called the ventral rami. The ventral rami will come together, they make the trunk. The superior, middle, and the posterior, the inferior trunk. And the trunk will branches up and get into the division. And then the division will come again to make the lateral, posterior, and the medial cords. And the cords in turn will turn into your peripheral nerve that control the muscle, skeletal muscles on the upper extremity. Okay, that we shown in a different model. Alright, so we talk now about the thoracic area right here. You can see those bolts right there, they make a whole chain. They are called the sympathetic chain ganglia, or you can call it paravertebral ganglia. And from the thoracic section, there are three ganglia that extend up into the cervical section. We call those three are the cervical sympathetic ganglia. And all these ganglia here is for the sympathetic division of the nervous system, okay, which is a flight of fight system. Okay, so you might be asked to count the spinal nerve, which is easy. So you're just gonna go through the go along with the vertebra number, and you'll be fine with that. And this guy right here, in between the ribs, are the intercostal nerve. Okay. So going down here, we have the sacral plexus. We got big nerve that comes up from the sacral plexus. That's a femoral nerve that will control all your quad muscle, and also the muscle control the extension of knee. And that one right there that runs to the obturator foramen is your obturator nerve that passes through your obturator foramen and control the medial compartment of the thigh. And down below is your sciatic nerve, it's the biggest nerve, and it runs the entire length of the leg. That control most of the posterior compartment of the leg and also the shin. Okay.